finishing up week 4, and clinical day has been pretty cool. Took my first TAPSE measurement, which is just measuring left ventricle in the apical 4-chamber view, and I'll update giving some pathologies and what I'm studying later when I'm out of here. All right, now, so this is basically what's going on, but the cardiac conduction cells are going to go in a summit, plummet, continue, plummet formation. Basically, that just means the sodium is going to be in depolarization. So it's going to rise at first as they start opening the walls for the channels. Afterwards, it's going to briefly plummet as the potassium comes in due to the influx of the sodium based on the unbalanced charges. Finally, we're going to be excited with calcium, which is going to end up continuing that voltage in the cell membrane. And finally, after we have a lot of charges, the potassium leaves, and that's why we lead to this plummeting and repolarization. Now, as we all know, the heart contracts and fills. That contraction is called systole, and when it fills up with blood, that's called diastole. And you're gonna see in the hospital, you'll see EKGs or ECGs, you'll see those leads before they connect those wires. That is basically gonna be in a triangle formation because of Einthoven's triangle, where we don't want the charges to interact with each other to interfere and mess up how we see the waves of your heart in this measurement. So I'll explain it. So this is going to be the EKG. So the P is just going to be your atrial depolarization. The PR interval is going to be from the start of the P all the way to the Q, and that's just the distance between the onset of the atrial depolarization and the onset of the QRS complex, which is the ventricular depolarization. Then we have the PR segment, which is the small segment right after that small P wave to the Q, and that just allows time for atrial contraction and complete filling of the ventricles because we're about to go into that systole. Then we have the QRS complex, which is that huge thing up here, which is going to be ventricular depolarization and atrial repolarization, which is hidden because when we're contracting the heart, everything's going to move, so we're not going to really see that. Then we have the ST segment right after, immediately right after the small segment, just the time between the ventricular depolarization and repolarization with some ischemic changes, followed by the J point, which is right after we had that small kick, and then the T wave, which is the ventricular repolarization, where we return back to normal essentially, so we can start the heart filling in diastole. And then the QT duration from here to here is just the total time for the DN repolarization.